Yeah.
Okay, shifting gears a little bit is your oral health. There is a direct correlation between your oral health and your heart health and everything else. Well, Dr. Towns got more.
If you were to line up 100 people and ask them what their greatest fear was, well, they might tell you it's heights, they might tell you it's flying, or they might tell you it's going to the dentist. Joining me now is Dr. Towns. Welcome onto the show. All right, let's get to the truth here. What are some of the things that people do right now that is the worst for the oral health?
I mean, they usually will pack things into their teeth and not really try to clean them out, or they'll dig at their teeth with toothpicks thinking they're just getting the food out, but they're actually harming their gums. So they chew on ice, they grind their teeth, all sorts of things. I mean, they'll hold a nail with their two front teeth. You know, if they're trying to hang up a picture, they think, oh, I'm just going to hold this with my tooth and then they
I
break
think
their
you
front tooth.
probably at least listed one or two things right now that our viewers at home are going, yep, I do that. Let's talk about flossing.
Yeah.
How important is it for someone that flosses?
Flossing is super important because you're missing so much in between your teeth if you don't floss. Like, brushing is great if you get all the outsides, but you know, there's so much that you can find. You'd be surprised if you actually took floss, and if you're not a flosser, to run that in between your teeth, and then you pull it out, and you see all this plaque and bacteria in food. So it's important.
Okay, let's talk about coffee, sodas, things like that we might be drinking. What is that doing to our teeth?
I'm a coffee drinker. I love my coffee. Everything in moderation is okay, but the most important thing that people don't realize is that it's the time exposure of that sugar. So, for example, if you drink like a Red Bull, or you drink a Coke or a Sprite, or Dr. Pepper is the #1 thing that dentists are always like, oh my gosh, you drink Dr. Pepper, let's take a look. Because all that sugar that's packed in there creates an acid, and it starts creating cavities on your teeth without you even realizing it.
Let's talk candy real quickly, coming up on Halloween next month. What is the worst candies for your teeth?
Sugar Babies, Jolly Ranchers, anything that's sticky, chewy, Laffy Taffy, those are usually the ones that people are either they're eating that and then they're chewing on something really sticky and then it takes a crown off, or it takes a filling out, or it makes a tooth crumble. I mean, it happens. This is the time of year.
Okay, I'm going to admit right here on the show that I had a partial tooth break apart. Back in the back, it's like the second or third one on the right. You can probably tell me exactly which one it is. What should someone do right now if they have toothache from maybe a missing tooth or a partial tooth? What can they do?
A lot of people think that if it's a toothache and it's hurting so bad, they need to come into the dentist. They need to come in and see us right away. Because even if it goes away within like a day or two, and they think, oh my gosh, it feels totally better. It was hurting real bad for a while, and I couldn't sleep, and I was, you know, it was too much to bear, and all of a sudden it stopped hurting. They think, oh, everything's okay. My body fixed it. It's not the case. Usually that nerve is dead.
Yeah, I'll say right now to the viewers, I was in excruciating pain for probably 2 weeks. And I mean pain. From 1 to 10, it was 11. Yeah. It was bad. Then it went away. So I am going to follow up on that and take your advice. So if there's any takeaways from this segment, and there's a ton of them, it's floss, right? Don't drink sodas. Water's good for you, obviously, right?
Right. Water's great for you. It's neutral pH. It helps clean everything off. More importantly, go in to see your dentist. And if you don't have a dentist, we'd be happy to see you in our office and take care of you.
There you go. All right, there you have it. Information is up on your screen. Go check it out. Go book an appointment with them and have a better oral health, I guess you could say. All right, cool. We'll be right back.